8 Pneumonia symptoms that you shouldn't ignore. Pneumonia is an infectious disease that directly attacks the lungs. This disease usually affects people with weak immune systems, such as the elderly or children. And pneumonia symptoms can lead to different problems for a person's health. So, that's why detecting it as early as possible is so important. If you want to know more about causes and pneumonia symptoms, you'll find all the answers in this article. Don't miss out. What exactly is pneumonia? The lungs carry out one of the most important processes of the human body, respiration. They distribute oxygen and expel the carbon dioxide from our body. Pneumonia is an infection of one or both of the lungs. The infection causes the lungs to fill up with liquid and pus, making it considerably harder for a person to breathe. It can be life-threatening because of the decrease in oxygen, accumulation of carbon dioxide in the body. What are the causes of pneumonia? Microbes, bacteria, viruses and fungi usually cause pneumonia. They can be contracted through a wide range of ways, such as bacteria and viruses originating in the nose, mouth or paranasal sinuses can move towards the lungs. Inhaling microbes. Inhaling certain foods, liquids or secretions, among other things. Infection from pneumococcal disease. Flu complications. Infection from fungi. What are pneumonia symptoms? First off, pneumonia symptoms can vary according to each case and the progression of the disease in a given patient. The most common pneumonia symptoms include 1. Chills. Normally, people suffering from pneumonia experience chills several times a day. These chills can last from anywhere between 30 and 60 minutes. Fever and cough. Fever and cough are commonly the second symptoms seen in those afflicted by pneumonia. They can show consistent fevers that reach up to 40 superscripto C, 104 superscripto F, overall sickness and cough. Mucus and phlegm may also be present in coughs. They may be brownish red or yellow-green in color. In some cases, blood might be present. Likewise, the fever and cough might be preceded by a throat infection. Breathing difficulties. Breathing difficulties occur due to the little oxygen that the body receives when it suffers from a disease like pneumonia. It's more apparent when undertaking activities that require physical effort, like climbing stairs, walking quickly, lifting heavy objects. In addition to making it harder to breathe, this disease can also lead to quick, shallow breaths. Pain when breathing in. People suffering from pneumonia usually experience pain when breathing in. The pain results from an inflamed pleura, better known as pleuritis. Numbness and color changes in limbs. The lack of oxygen in the body can cause coldness, inflammation and numbness in the following areas: lips, tongue, body limbs, fingers, nose also. All of these zones may even appear blue or purplish. Joint pain. Some people suffering from this disease can have consistent joint pain due to the little amount of oxygen flowing throughout the body. Confusion. In some cases, pneumonia can lead to mental changes like confusion or disorientation in the elderly. White nail syndrome, also known as leukonychia. This syndrome can result from chemical poisoning, cardiac diseases, pneumonia or hypoalbuminemia. In addition to the previously mentioned, other pneumonia include excessive sweating and sticky skin, little energy and fatigue. If you show several of these pneumonia symptoms, you should ask your trusted physician to undergo the appropriate tests for this disease. By doing so, you'll be able to start the proper treatment for your case. Featured image courtesy of copyright wikiha.com.